implants on this. And then in the third area, the patient will come to you and you will see completely exposed abutment area. And there is no way you can solve this issue, because you don't have a reason which will justify it. And this treatment will be in terms of time frame, it will be the same time frame like placing your implant. Because like you sort of Dhru's case, it almost take him 6 months to, like with all those complications, to pursue and complete that case. So implantology is just about killing time if it goes wrong. And the patient, if it's cooperative, it's good. If it's not cooperative, he will just, like, it's too nagging to deal with such patients. So this is about the mesiodistal width, about the comfort zone, maintaining the blood supply of 1.5. Now let's come to the biomechanics. Let's take a small break. If you have any questions, you can ask. But breathe sometimes. I think it's too much information for today. If you have any questions from the biologic part of the lecture, let me know. Now we will start the mechanical part of the lecture. I think everything was too clear, or you did not understand anything.
Flapless procedures nowadays, is it
flapless? It has, like, you need to be prepared when you're doing flapless. Like you have to do completely guided if you go flapless, or at least pilot guided surgery. Because if you don't, see, implants will only give you one chance when you're drilling. There is no second chances in implants. If you go wrong with the pilot drill, there is no coming back. They will say that, okay, no problem, we have invented this Litterman drill with side cutting, you can always change your orientation. But once the path is established, see, implant is, it's a mechanical entity. Any mechanical entity will always, when you place it, it will always follow the least path of resistance. So no matter how well you do the adjustment of the osteotomy, when you place an implant, it will already be shifting on the buccal side. Why? This was again, like, these are the questions that I asked in the lectures. And maybe I was too stupid at that time, but I asked this question. I said, there was a very good lecturer who came when I was studying, and he was actually telling about that when you try to place an implant, it will always shift towards the buccal side. So whenever you start the osteotomy, you should always don't go exactly at the center, but start a little bit lingual, because by the time you finish the drilling, it will always be in the center. Why? The question is, you have to ask this question, why? Exactly. Because the bone is just softer. A little bone of the lingual plate is always harder, because this is how our body is designed. And this is like even from Dr. Dhru's, like when he was showing the chewing cycle. So everything was coming more on the lingual side. It was not going on the buccal side. So this is again according to Wolff's law. Everything is justified. Everything has a reason why it's happening. So when the chewing cycle, it's coming like this, it's more towards the lingual. Because it's on the lingual, according to the Wolff's law, the lingual plate has to be stronger because it's reactive to that stress. It's very simple. Everything in implants is justified. All complications can be tracked down. Everything can be calculated. So if someone comes and says, Salman, I don't know why this fracture happens, okay, find out. Go deep, learn, read. You will find the exact reason. And once you find the reason, I'm telling you, you will not repeat it. You will never repeat it because it costs a lot of money and a lot of headache from the patient. So let's come to the biomechanics. So this is purely about how the load and how the bone behaves. So this is Frost hypothesis. So there was a guy called as Frost, and he said that when you actually have bone, the bone behaves in 4 ways. So you have windows. So one is something called as disused window. What happens when you extract the teeth? Resorption. Why it happens?
No function.
No function. It's called as disused bone. So according to Frost, it doesn't happen. The bone resorption happens because there is no optimal load which is getting on the bone, and that's why the bone and the body is very smart and intelligent. It takes whatever calcium, whatever components are there, and it uses somewhere else because it's not used there. So this window was called as diffuse atrophy. The second is, it's the modeling phase. So as I told you in the beginning, when you load the bone, there is constant remodeling, formation and resorption, like it's completely remodeling. It's very dynamic tissue. Then the third thing is usually the ortho guys use it a lot. It's optimal load or optimal forces to move the tooth. So what happens is when you actually load the bone in the optimal area, that bone, instead of resorbing, it gets even stronger because it's always under stress, always under tension. And the last one is the pathologic load or overloading, and it fails. So this is happening when you're using a very narrow implant on a very wide prosthesis. So if you're using an implant of 3.3 millimeters in a molar region, and then the patient comes after 2 years and there is a V-shaped bone loss, and you are like, okay, nothing happens for 2 years, why it's happening now? It's because of the bone is failing to cope up with the stress. So again, as I told you, when you place an implant exactly according to the load transfer area, there will be minimal failures because the bone is very good in taking compressive forces. The moment you do an off-axis load, there will be pressure and tension plane which will be created. So